Sago, and welcome to a live edition of CKON Wednesday to Watala. My name is Reen Cook, and we remind you views and opinions expressed by our guests and our callers during Watala, not necessarily those of 97.3 CKON or the Akwesasne Communication Society. Our phone lines are open if you have any questions about today's topic at 518-358-3427, 613-575-2101. And we will take your questions to address our guest following the beginning of the program, which is his presentation. So we will take your calls again at 518-358-3427, 613-575-2101. So our guest today is Mohawk Council of Akwesasne Grand Chief Abram Benedict, and he is joining us today to provide an update from the Mohawk Council of Akwesasne, including the current COVID-19 updates, also information on the vaccine passport, the general meeting from October, the fuel allotment, and also holiday dinners, another item that he'll touch on. So he'll confirm that for us when he opens up his presentation. And again, we will take your calls and our operators will jot down the questions, and I'll do my very best to get the answers that you're looking for. And also to let you know, we will be on Facebook Live. We currently are on the Mohawk Council of Akwesasne's Facebook page, so you can actually watch the interview if you would like, and listen to it on the radio as well if you prefer. So either way, we've got you covered by way of today's program with the Grand Chief. So with no further ado, we welcome the Mohawk Council of Akwesasne Grand Chief Abram Benedict. Sago, and welcome, Grand Chief.
Sago, Reen, good afternoon. We're good? All right, good. So it's great to see you on the Zoom, and it's great to be back on the radio this afternoon to provide you and everybody with an update. I want to say Yango, as always, to Reen and the team at CKON for the opportunity to come to you via the Facebook and on the CKON Radio. As Reen mentioned, I'll be providing an update on the current COVID-19 updates, a bit more information on vaccine passport information. I want to share some information from the October general meeting, provide you with an update on the fuel allotment for this year, and a little bit more information on the holiday dinners. As always, I want to acknowledge that everything that has happened during this pandemic has not been easy for any of us. While things have changed a lot again and restrictions have generally loosened up, I want to ensure that everybody's reminded to exercise caution. Regardless of what the directives are, we need to continue to be smart and safe. The pandemic is not over. In fact, in the last little while, we've seen a rise in cases in and around our community. The Delta variant continues to be the major contributor to new cases, and data still continues to show that the new cases are of individuals aged between 20 and 39 years old. And this is, and it continues to be extremely important that we all get vaccinated to keep ourselves and our most vulnerable people in our community safe. Health Canada has declared now that we are in the midst of a fourth wave, and we continue to manage the impacts of this to our community. Well, the data now shows that the fourth wave has shown that it's basic and less restrictive measures, such as wearing our masks and maintaining social distancing, has overall slowed the spread of COVID-19. It's important, again, that people recognize that maintaining social distancing and wearing a mask has showed to slow the spread of COVID-19. Also, practicing these measures over the upcoming winter months will help us mitigate a surge in new cases. While Canada is now reporting that the fourth wave is declining, unfortunately locally it has been a bit of a different story. The Eastern Ontario Health Unit has reported that new cases in this region are one of the highest in Ontario. In Akwesasne, we have seen a trend of new cases as well. This is a staunch reminder that we as a community are not immune, and we need to bring up our vaccination rates. As well, the Cornwall Community Hospital has reported to us that they have seen a steady increase of members of Akwesasne community requiring critical care from the Cornwall Community Hospital. And the critical care is also known as the ICU unit. Reported data also continues to show that most new positive cases are from unvaccinated individuals, and again, that includes members of our community. The Mohawk Council continues to offer COVID-19 testing on Tuesday and Thursday by appointment only. And as of last week, we have administered 4,435 vaccinations, which includes first and second doses. And that number continues to climb, but not as quickly as we'd like it to. As always, those members who have questions or unsure about the vaccine are encouraged to reach out to one of our doctors here at the Mohawk Council or at the St. Regis Mohawk Tribe, or one of our nurse practitioners to discuss the vaccine, its benefits, and its effects. The MCA continues to offer COVID-19 vaccination by appointment by calling the Community Health Program at 613-575-2348. I encourage everyone who is not vaccinated to consider getting vaccinated. As previously reported, on September 22nd, the province of Ontario implemented the requirement for proof of vaccination for certain recreational and public settings. Individuals will need to provide proof of vaccination that they have received their second dose of COVID-19 vaccine at least 14 days prior to attending certain functions or events or places. And those could include restaurants and bars, which do exclude outdoor patios and delivery and takeout, nightclubs, which includes outdoor areas of nightclubs, meeting and event spaces such as banquet halls and conferences and convention centers, facilities used for sport, fitness, personal fitness training activities such as gyms and recreational facilities, with the exception of youth recreational sporting events, casinos, bingo halls, and gaming establishments, concerts, music festivals, theaters, cinemas, and racing venues as well. While attending any of these venues, individuals will be asked to show their proof of vaccination with a piece of government issued identification. Children under 12 still continue to be exempt at this time. These mandatory requirements will not be applied to outdoor settings where the risk of transmission is lower, with the exceptions of outdoor nightclub spaces. This approach focuses on a higher risk indoor public settings where face coverings cannot always be worn. Community members can email covidvaccines@akwesasne.ca to obtain a copy of your COVID-19 vaccination receipt. In your email requests, please be sure to include your name and date of birth. Community Health Program staff will input the information of your record into the Ontario Provincial Health System. Once the information has been put into the system, you'll receive an email with your official vaccination receipt within 1 to 3 days. It's important, those of you that have questions about obtaining your vaccine receipt, please reach out to the Community Health Program. Email them at covidvaccines@akwesasne.ca. And as of October 25th, 2021, Ontario has lifted the vast majority of capacity limits in restaurants, bars, casinos, bingo halls, but you still are required to be vaccinated to enter the place. Last Thursday, our council hosted our monthly general meeting using the Zoom platform. Our agenda included a presentation on the AMBI COVID protocols, COVID updates, the 2021-22 heating assistance program, Halloween information, and an update on the 2021 holiday dinners. AMBI highlighted that classes this year are smaller than previous. All children in kindergarten are required to wear masks. Additional masks and PPE is being provided. Children are also provided with an opportunity for social distancing and social distancing mask breaks. AMBI is in regular contact with the community health for active guidance. Again, this year, children who are sick are required to remain at home, and the parents are asked to consult with community health. Any household with a sick child and the rest of the house, we are asking the rest of the household to isolate as well until cleared by community health. These measures are in place to minimize the risk of spread of COVID-19. During a recent survey of the parents, it has resulted that 92% of the families agreed to remain in person for a 5-day schedule over a hybrid model. For the time being, classes will remain in person, and let's continue to hope that they remain in person, and this is all based on how the case levels go. It is our hope that we can make it through this year. Also part of AMBI is childcare, and the childcare centers continue to slowly increase the capacity at each center. We are facing challenges with having a number of adequate staff to expand our capacity limits. And I will say that we also are having some issues with staffing support staff within the school systems. Again, families with sick children are required to stay home, isolate, and contact community health for guidance. This is extremely important to ensure that if children and families are sick, they're not coming into school, the facilities, whereby risking transmission of their sickness to others. The Mohawk Council of Akwesasne is again offering the 2021-22 Akwesasne Heating Assistance Program throughout the upcoming winter months. For individuals who are 59 years and under, you'll receive the assistance amount of $500 per eligible head of household, and those elders 60 and older will receive $800 per eligible head of household. The eligibility application process now includes Akwesasne who are residing in the municipal boundaries of the city of Cornwall. The applicant must be a registered member of the Mohawk Council of Akwesasne under the Akwesasne Membership Code. And this program is also extended to clients of the Community Support Program. Applications from last year are now being reviewed over the phone with community members. You do not have to fill out a new application. This will be automatically done by the staff Community Support Program based on your application from last year, and they will be reaching out to you to verify that information. If you are a new applicant and have not applied for Heating Assistance Program in previous years, we ask that you please give the Community Support Program a call at 575-2341, extension 3262. Even if you are unsure, give them a call to verify your information. Once the application and information is received and approved, your name will be provided to your heating source provider as per the information that you provided. The application deadline is December 10th. There will be no exemptions for this deadline. So as we get closer to December 10th and you have not received a call from Community Support Program, please give them a call to verify that you are on the list and they do have your application. In previous years, we have done the community dinners. And as we know, last year's community dinners was not possible because of the COVID-19 restrictions. This year, we have made a decision that while we are seeing a turnaround in the with restrictions relaxing, it still is probably not advisable to hold such a large gathering in our community with holiday dinners. So this year, we will be providing a holiday package to every home within the community. All the details have not been yet worked out, but we will be sharing more in the coming weeks, more particularly at our next general meeting, which will be taking place on December 2nd using the Zoom platform. So please stay tuned. There will be no holiday dinners at the recreations this year with the Mohawk Council, but we will be having an initiative that will entail going door to door for each community household. Serene, those are my formal updates for this afternoon's update. But as always, I'm willing to take questions from you and the community about anything that I presented or any other matters that they'd like to have more information about. Yeah.
All right. Thank you again. We're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, and he's providing a monthly update. Comes by about once a month and provides information, a little more information than the briefs that we receive. So he talks about it, gives you that information, and then you have the ability to phone in if you have any questions about anything he talked about here today or anything having to do with items or files under the jurisdiction of the Mohawk Council of Akwesasne. So Grand Chief, before we get started, I'd like you to let us know what the vaccination requirements that are mandatory for the Mohawk Council of Akwesasne. Can we clarify that and let me know if your staff at the Mohawk Council of Akwesasne are required to be vaccinated?
Yes, absolutely. So on September 27th, Council accepted a policy, the COVID vaccination policy that was applicable to all staff as well as service providers, contractors of the Mohawk Council. And essentially what that policy did come into effect on October 29th. But essentially what that policy means is that any employee of the Mohawk Council is required to attest that they have been vaccinated. And if they are not, there is a period of time where they have to be vaccinated. And if they do not, they are required to participate in an education seminar to ensure that they are aware of the risks of not being vaccinated. And then they'll be subject to regular testing, rapid testing, to ensure that they are not, in fact, carrying the virus. Now, I will say that, you know, this decision to implement a policy like this has not come lightly. There was lots of discussion with council administration about this, but I can tell you that a number of organizations at government levels as well are implementing policies very similar to this. In fact, we have seen for a number of months that hospitals, long-term care providers like us at Akwesasne have been required to be vaccinated already several months ago, including our daycare centers and the support staff there have been required by ministry to be vaccinated. So this policy that we put in place is an effort to ensure that we're keeping the workplace safe, but also the Mohawk Council is a service provider to the community, and we want to make sure that as they access services from the Mohawk Council, that that we're taking all measures to ensure they are safeguarded from the spread of COVID-19.
Okay. Now, my next question is, you guys announced this week that the all MCA public events, in order for people to attend, they have to be fully vaccinated. Can you confirm that and clarify that for everyone and what that means?
Yeah, absolutely. So not only have we've implemented the requirement for staff, service providers, contractors of the Mohawk Council to be vaccinated, we've also taken the move that anybody using one of the MCA facilities, example, the recreation centers, tri-district elders, the homemakers, need to be vaccinated as well. We know that these are centers that are used for congregating, but we want to make sure that those persons that are gathering there, whether it be for an event or for MCA function, are vaccinated. Now, this does fall in line as well with a number of initiatives happening in and around our community that people using these facilities do have to be vaccinated. So as it works right now, if there is an event planned at one of the facilities, they're required to work with the EOC, the Emergency Operations Center, to submit what they call an event plan, which just gives details of what they're doing, how many people they expect, and that the minimum safety requirements are going to be happening, i.e., having sanitization available, that people are vaccinated. So these plans will be submitted to the EOC, and they'll work with the event coordinator or renter in some cases, depending on what the event is, to ensure that they're using the facility safely.
All right. So everybody, for example, if I wanted to rent the rec and have a birthday party there, so yes, that's coming to my birthday party has to be, as long as they're of age to be able to get a vaccine, everybody has to be double vaxxed in order to attend my birthday party?
If you are at an MCA facility, yes.
Okay. Who's going to police that?
Well, it will be on the event coordinator, or who applies for, well, not applies, but who makes the application for the event itself that goes into the EOC, and that individual will be responsible to ensuring that people are vaccinated. Now, I know this is not, ideal. One of the questions we have been receiving on the staff vaccination, this policy, is this going to last forever? And at this point, this is where we're at, and where we're at this point of time of taking measures to ensure that we're being safe, that we're doing the best we can to slow the spread or stop the spread in the community. These will, these directives could be relooked at, will be relooked at periodically, and will they exist forever? I can't tell you that. I mean, we know that, the virus continues. We're 18, 19 months into this now. We have seen lots of things come and go. Masking mandates were not always there. They've come in place. They are there in different jurisdictions. They still continue to be in our jurisdiction, but in other places they are not. Right? I mean, we have, through the course of the pandemic, implemented various measures, i.e. the travel radius, the curfew, were other measures that we put in place. And as we've moved through, we've, modified and then, removed them altogether. So the pandemic continues to change constantly, and will we be required to be vaccinated, for the indefinite? Not sure. I mean, we have to rely on the science, and, the decisions that we are, putting in place, or decisions we are making to put in place measures to protect people, are based on the science around COVID-19.
All right. Now, again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, talking about updates for the community and questions from the community. I'd like to take you back to the mandatory vaccination requirement for staff. And you mentioned an alternative for individuals with regards to rapid testing. Now, is that something that's paid for by MCA, or does the employee of MCA, if they choose that route, have to pay for the rapid testing?
As it is now, the policy does say that employees will have to pay the cost of the test, but right now we are not paying for the tests. The tests are being provided to us as a community government for no cost to us. So therefore, there is no cost to the employees that are required to test. If, at some point, will there be a cost? It could be, but as long as we're not having to pay for the tests, there will be no cost to the employee.
And with regards to religious exemptions, are those being allowed for?
They are, but I can tell you, and I think we've covered this a bit before in the past, that all medical experts and every venue that I have been in where they've talked about exemptions are very far and few in between. Now, there's been, obviously, for religious exemptions, there is a lot of sensitivity around that versus the medical exemptions. But all service providers, medical people know that exemptions are not given easily. So, if an individual that works for the Mohawk Council does have an exemption, and it is by a doctor, or has been provided by a spiritual advisor, or what have you, those will be honored.
All right. Another question: how will MCA protect our elders at Akwesasne, Giunganusade, and Sweetgrass Manor from unvaccinated MCA employees?
Mm-hmm. So the two for long-term care facilities, or the two facilities that we have, Akwesasne and Giunganusade, do fall under ministry directives. So they have been required as staff to be vaccinated for quite some time now. The ministry has required them those who are not vaccinated, to be subject to regular testing. And this has been in place for several months now, prior to any of the staff abroad being required. As far as the other facility that you mentioned, for them, they would be being serviced by some of the housing staff or the DTS staff. So As part of the implementation of the policy, all staff will be required to be vaccinated. If they are not, and they are working in vulnerable sectors or sectors where there's a higher population of elders, like the facilities you've mentioned, they could be redeployed to other areas, or they could, part of the policy does include, disciplinary measures, but clearly those are all administrative matters, though I can't speak, in more detail about them, because that's the decision of the administration of how they will implement that. But I can tell you that those are the measures that are available to them.
All right, another question. Why does MCA have two standards for people entering MCA facilities, one for MCA staff and one for community members?
I'm not aware of two separate sets of rules. Every person entering into an MCA facility needs to take their temperature. Their temperature needs to be taken to ensure that they don't have a fever, which is a symptom of COVID-19. But also they need to answer a series of questions, whether or not they have been exposed, whether or not they have traveled, or sorry, not traveled, but whether or not they've been exposed, whether or not they're feeling good or not feeling good. Every person entering a facility is subject to the same screening. If there is a situation where they're not, that needs to be further investigated with the supervisors.
Let's look at the other side of that. If they're asking with regards to vaccinations. So we talked about MCA and the mandatory vaccinations for your staff. And then there are the individuals that do not want to get vaccinated, but are able to do the rapid testing. So maybe that's a part of the question, or maybe someone is wondering that. So if we go to the recreations or the tri-district elders or anything, why can't we just have a rapid test and go to that? And well, the employee of MCA is allowed to get the rapid test and go to work. So let's talk about that aspect or angle of that question, in case that's where they're going with it.
Yeah, no, absolutely. Well, so the rapid tests are, we don't have a huge abundance of these around. And in fact, anybody that has traveled or has gone to certain venues know that these tests are not cheap, right? If you're traveling abroad, I think that the fees are anywhere starting at $100, upwards of $200 for a PCR test, which is a quickly done test, but it's not the same as a rapid. So, there is a cost associated. We don't have, a stockpile of tests right now to be able to test everybody coming into a birthday party at the recreation center or what have you. So, we're trying to find, the balance in this, but also to make sure that we are doing the best that we can to make sure people coming into our facilities are safe. If you are receiving coming in to receive a service from us, pick up paperwork or what have you, you don't have to be vaccinated. You should be vaccinated, but if you're an employee, then yes, you do. You're in the facility for a long period of time. So I see where the question is, the community member is coming from. If I have to be tested, why doesn't everybody else have to be tested? The science has shown that people who are vaccinated are less likely to get it. Yes, people who are vaccinated can get it, but all of the information is showing that elderly people are the ones who are likely. There are some younger, but statistically, most older people that are vaccinated are at higher risk of getting the virus anyways. And that's why, as of right now, the ministry has talked about the third shot or a booster shot. The boosters have been given to everybody in the long-term care facilities. We are waiting for ministry directive to say that we can roll it out to age, the elders at abroad. Now, I know that the CDC on the southern side of the community has started that, including the tribe, but we haven't at this point. But we're doing the best that we can to make sure that we're balancing this, but also doing what we have to keep people safe. The data, the science shows that being vaccinated is the best way to protect yourself in our community.
And what about AMPS and AMBI? Are those two umbrellas? Do they have mandatory vaccination policies as well? That would be Akwesasne Mohawk Police Service and Akwesasne Mohawk Board of Education.
Yes, they do as well. They are part of the Mohawk Council, and they have to be vaccinated as well.
Another question: in the late winter, early spring, earlier this year, some community members received 1 or 2 checks of $900. Why were only a select few eligible to receive this check? And why didn't every community member get one?
I don't know what specific benefit they're talking about. I mean, if there have been over the course of pandemic a number of initiatives by the federal government, I don't know if they're referring to that or of the Mohawk Council.
Okay, so I believe the person said the checks were COVID relief checks for context.
Yeah, that doesn't help me answer that. It was through community support had given some supports to them, to their clients. That's what they could be referring to. Unfortunately, I don't know what the criteria was. I think that they just had to be a client and a head of household. So if there was 2 recipients in one household, only one of those individuals would have gotten the COVID check, not both.
Okay. Why are people who are not vaccinated allowed to use the COVID antibodies test to show their immunity? Aren't they more immune than the vaccinated? So I think they're missing a word here. Why aren't people who are not vaccinated not allowed to use the COVID antibodies test to show their immunity? Aren't they more immune than the vaccination, those that have been vaccinated?
So we're not doing any testing for antigens. I mean, the testing that we do is whether or not the individual is positive or not. We're not testing to see if you are more immune than myself. So the antigen test may be available, but it's not a measure. It's not a mechanism or tool that we're using at this time.
With the hiring policy for the Mohawk Council, why don't new hires have the option to get tested every week like current staff do?
Yeah, so I mean, part of the directives that we have given, or the council has given, is that all existing staff have to show proof. If not, they have to participate in the education program. Then they will be subject to regular testing. All new staff hired within the Mohawk Council have to be vaccinated. It's you know, I mean, we're trying to get more people in our community vaccinated, more people in our organization vaccinated, and bringing in individuals who are not vaccinated is not is contrary to what we're trying to achieve at this point in time. Again, I know there's a lot of controversy around this. People want to know, well, is this going to be forever? This is, you know, we'll continue to reevaluate this. Whether or not it's going to be required, you know, forever, I can't answer that, right? I mean, you know, we have to think about the boosters or the shots that are given to our children, you know, earlier on. And, you know, did they ever think that these would be forever? I'm not sure. Are they still required? You know, I mean, we don't have outbreaks of some very nasty diseases because, you know, bulk of people are vaccinated against, you know, measles, polio, you know, terrible things like that. So are we going to be head towards that? I don't know. I mean, we have to just take this as we can. If this, you know, miraculously dissipates off the face of the planet and, you know, we don't need to be protected from it, or we do have natural antibodies, then, you know, it'll be behind us at that point. So it's continuously rapidly changing for us. But for the foreseeable future, employees will be required to be vaccinated and new hires will be required to be vaccinated.
All right, another question. This listener wants to know why people have band cards and are non-native. Listeners have This listener says they've seen it in Cornwall. Can MCA do anything about that?
Over the years, we've received different calls about various situations of individuals who other individuals felt should not have a ban card or status cards. Status cards are issued by the federal government under Indigenous services. There is probably a number of scenarios that could have led to the situation that the individual has described. Unfortunately, we don't have the ability to determine who gets a status card. What we do have the ability to do, though, is determine who's a member of our community through a process under the Akwesasne membership code.
All right, another question. Let's see here. Again, we're talking with Grand Chief of the Mohawk Council of Akwesasne, Abram Benedict, and he's fielding questions from community members. We did our first part of the program with his presentation, which we normally do each time he comes in. And we thank him for taking the time today to address these questions that are coming in from community members. So let's go back to the MCA facilities, the recreation centers, tri-district elders, homemakers. This community member listener wants to know if a community member rents the Gawanoge Recreation Center, can they request that visitors have 2 shots, and will crafters need 2 shots to attend and host an event?
Mm-hmm. So, as part of the policy, any individual entering into the facility for a purpose of a function will have to be vaccinated. So if you were, hosting a birthday party there, unfortunately, all of your attendees will have to be vaccinated. If you are going to be a vendor at a craft show or what have you, you will have to be vaccinated as well.
Another question has to do with some of our facilities here in the territory under MCA jurisdiction. What about the shelter on the island? And does it have to follow the ministry guidelines as far as vaccination for those that are housed at the shelter? And also expanding on that, for Yakisota and Junkanusade, are all of the residents or those that are utilizing the shelter for room and board kind of deal, will they have to be fully vaccinated, or are they fully vaccinated? Is that a mandate for the residents?
So the residents at the long-term care facilities are vaccinated. In fact, they were the first ones in the community and across the country that were vaccinated in long-term care facilities. So Junkanusade, Yakisota, all of the residents are vaccinated there. In fact, at this point, most of them have received their booster shot. As far as the shelter goes, the staff that work there, which are staff of the Mohawk Council, they are required to be vaccinated under the policy. If not, they have to do the programming and be subject to regular testing. The people, the clients that are there, it's my understanding that if they are not vaccinated, they will receive testing as well.
All right, next question. Looking at term employees for the Mohawk Council of Akwesasne, why can't term employees who receive no benefits get COVID relief?
I don't know what relief they're speaking to. The requirement for term employees would be the same for being vaccinated. If the terms expire and can be renewed or what have you, they'll be required to be vaccinated. But as far as COVID relief, I don't know what that means.
Okay. Moving on to another question, I guess, connected to that. Can long-term employees for MCA donate to a sick time bank for short-term employees?
I believe I'd have to look. There used to be a donation of time, but I don't know if that's still in place. And that was for employees who had, a good amount of accrued time could donate to another individual. I don't know if that's available, but I mean, the question is clearly from a staff member, and those would be covered, through the personnel policy. They'd have to take a look and see if it's still in there. There used to be a donation of time. I think that it was changed though from time donation to being able to donate financially, because not everybody's banked hours are the same or equate the same. But it is also, I mean, there are case by cases in situations like this. If an individual knows that their coworker is very sick, whether it be from COVID or something else, they should approach their supervisor and discuss with them what they're thinking and what they'd like to do. I'm sure that some accommodations can be made outside of what the policy may say on donation of time. I don't know if the policy donation of time is still in there, but a case by case, I think is not unreasonable in this case. It's ultimately up to the supervisor and administration whether it's going to happen.
Okay. Another question: will unvaccinated bus drivers have to get vaccinated?
Any employee of the Mohawk Council, whether it be bus drivers, monitors, teachers, receptionists, are subject to the policy and will be required to be vaccinated. If they are not, then they'll be subject to the regular testing, have to do the programming, and until the policy is either altered or changed, that it is a requirement of them.
How are you keeping information on unvaccinated and vaccinated individuals confidential when unvaccinated individuals are required to wear a mask and a visor? And when will we have to start wearing the visors?
So the policy has been implemented now. Confidentiality, the person has to attest that they do have the vaccine. They'll have to provide it to their supervisor, which will go into their human resource file. And those are only accessible by the supervisor and the employee themselves. So the same rules of any other paperwork for an employee applies in this case, but the visor and those requirements have come into place, and any employee in the workforce right now can wear additional protective equipment if they feel that they'd like to do that to make themselves more safer. If, the requirement is when you are walking around and not at your desk and you can't social distance, you have to wear a mask. If you want to continue to wear the mask at your desk, from the moment you walk in the door to the moment you walk out, that's completely up to the individual. What the minimum is that individuals have to wear a mask when they're moving about and they're not seated at their desk. And individuals who are not vaccinated have to have additional protective measures in place.
So what do you think about the confidentiality aspect of that? Like, wouldn't they feel like an outcast?
They feel like they're identified.
Yeah.
Unfortunately, I mean, those are the measures that are in place. Yes, I think that they may at the forefront, but also, I mean, generally you're working in a space where people, this is your coworkers and everybody's supportive of one another. So if, you're sitting, Reen is in the next office to me and we have been there for the last 5 years, and I likely know your position on vaccinating, right? You either are or you're not, just because there's confidentiality, but we're in a workspace, so understanding and recognizing that your position is that you don't want to be vaccinated, and the employer's position is you have to have additional protective equipment. I'm not going to sit in my office and chastise Reen for her decision. That's not the workspace or work environment that I would like to be part of. So, I mean, yes, I would. The other end of the coin is, yes, you could be identified, but at the same time, you're not, you are a member of a unit, and I would expect that everybody supports one another on each individual's position. And if that's the requirement, then that's the requirement.
Okay. Again, we're talking with Grand Chief Abram Benedict, Mohawk Council of Akwesasne. Another question: if MCA is limited on free tests, Can MCA save tests strictly for community members who are not members? Let me see here. And have employees who are not members pay for their own test. So let me read that again for you. I'm sorry, it's written strangely. If MCA is limited on free tests, can MCA save tests strictly for community members and have employees who are not members pay for their own tests?
Yeah. So each employer in the community has a decision to make, and probably has made this decision already, whether or not they require their employees to be vaccinated or not. And that is each individual employer's choice to do. If they have a member of the community who works for them who doesn't want to be vaccinated, I mean, the testing is available on the market for rapid testing. There are kits that are large, not just individual one test per kit. There are tests with probably 50 in them. I don't know what the cost is. I mean, I don't want to say that we're going to start handing out tests so that employers can make sure that their employees are negative. Employers need to make those decisions. Employers are providing services to our community members. And, I think that at some point in time, we may be, asking as consumers, calling for a service provider to come in my home. And the next question, or is probably happening now, is, are your employees vaccinated? And if they're saying no, then you as the service, as the consumer, has a decision to make as well. Well, maybe you call the next company that is providing a service because you're not comfortable with those employees coming in. When we're at the point of a higher vaccination rate in our community, maybe some of these restrictions won't have to be as they are. But at the point in time we are at right now, we really are encouraging people to get vaccinated. When I talk to the CEO of the city of the Cornwall Community Hospital, and she tells me that there has been a trend of more people from Akwesasne needing critical care service, that's alarming to me. I do not want a single member of our community in the ICU unit in the hospital anywhere. But unfortunately, there is a lot of our people getting sick from COVID and needing more acute care, which is not good. We have seen, unfortunately, an increase in deaths in our community because of COVID, and that's terrible. We need to think about us as a family, as a whole community, and how we can protect one another. And at the minimum, the Mohawk Council as an organization is taking measures to make sure that people that are receiving service from us, people who are providing the service within our organization, are vaccinated and being safe, and making sure that the dudas, the elderly, the children that we serve are not going to receive COVID from one of our employees.
All right, another question. Instead of Christmas baskets, wouldn't it be easier to hand out gift cards for the community so families can get what they need or want instead of receiving some things that not everyone uses?
Well, those details will be announced in the coming weeks. It is, we're very conscious of, providing something that families don't need or don't want or not going to use. So there is a committee of council that has been working through the details on that, and it will be rolled out, in the coming weeks. The information will be released, and we'll be implementing it. So we're very conscious of making sure that everybody's able to benefit from the initiative.
All right, let's go to roads. How are we doing in the roads department? What's going on with Hilltop Drive? Is that almost ready to be paved? And any other road work that's happening in the 3 districts here at Akwesasne?
I don't know the current status of Up the Hill in Ganadago here. I know that it still is all rocks at this point. That was not just the road, though. They were doing some in different parts, the water line there as well. But those projects will continue to move forward until they can't pave anymore. But it's my understanding that that will be completed, at least the asphalt will be, the first layer will be on the ground before we can't do it this year. So it will be done this year. The priorities, excuse me, for moving forward are, other locations within the community. I know that there continues to be, Wade LaFrance Road is a priority as well for council. We have not lost sight of that, as well as the rest of River Road continues to be a priority for us. The downside of the pandemic, which there is a lot, has been that the priorities for council and the federal government, who we generally partner with on these things, have been keeping our communities safe. So as we move towards, higher vaccination rates, as we're moving in, different phases of the reopening, we are ensuring that our priorities are still recognized by our government partners, and we'll be moving those forward as soon and as quickly as possible to get those roads repaired for the various parts of the community. It continues to be a priority. We're going to continue to move this forward and work with our partners to get it done.
All right, let's go with information on CBSA with regards to the November 8th date for Canadians allowed to utilize the U.S.-Canada border and do so for recreational purposes, if you will. And when Canadians have to return to Canada, they have to have a negative COVID-19 test, PCR test, looks like, within a 72-hour period. So have you, when was the last time you met with CBSA? And what's going on with that? Do you have any other information to share with us, or, to confirm any information I just shared with you? Is that the correct information as of today?
So we just had a meeting with our border partners this morning, which we meet with once a month. We are going to be meeting with them again next week just to touch base. So the United States government has announced that starting next Monday, Canadians will be allowed to enter into the United States, but they will be required to be vaccinated. So as we know, here in our community, we have the exemptions from being vaccinated, the exemptions from showing a negative test, and the exemptions from quarantining for a period of time. So those will continue to be the same. So starting next week, nothing will change for us as far as requirements at the border to cross. What will happen though is that any individual that is non-Akwesasne, Canadians abroad, going into the United States, they'll have to have two shots, meaning fully vaccinated. So they'll have to be fully vaccinated. They may have to show proof of that at the U.S. Customs. As of right now, when those same individuals go back into Canada, they are required to have a negative test, regardless of their vaccination status. So they will be required to show a negative test that's valid from within the 72-hour benchmark. Now, we don't know if that requirement is going to change next week or not. As of right now, that's how it's going to happen. Now, we will be putting out a release to the community highlighting that information, but also advising the community that you may experience a little bit longer wait times, because there is the possibility that there will be an influx of people from Canada heading into the United States because they're now allowed to go there, which just means for us locally, more cars in line at the customs, which means delays for us.
Okay. Another comment from a listener. How long do you see this form of colonization within our community to continue?
I'm not sure exactly what colonization they're referencing, but I mean, obviously, external governments and their implications on us, happen at many different levels, including within the COVID-19. If the community member is referencing that and how the policies will be applied, I mean, as long as the colonizers' viruses continue to kill our people, we'll have to continue to respond to keep our people safe.
All right, what's going on with the wellness center in Cornwall. Is that going to be opening soon? How is that moving along?
So we had taken an initiative several months ago to provide a service center site for residents Akwesasne in the city of Cornwall, predominantly those who are facing homeless issues or challenges with finding stable, safe places to reside. We have made some arrangements with the Cornwall Care Center to lease part of that building, which is the old General Hospital in the city of Cornwall. We have a wing there. We've been working through issues around permits with the city of Cornwall and the owner. We've met today. We have an internal committee that's been working on the homeless initiative and within the Mohawk Council. And we think that we have, we have a chart, a pathway forward. We're going to be making the final improvements that we need to do there, and hopefully we'll have that center opened within the next few weeks. This is something that we've been working with very hard to open the center in the city of Cornwall. We've been faced with some delays around permitting issues, but I think that we have a pathway forward, and hopefully at the next update we'll be providing an update on what services can be sought there.
All right. Why won't MCA Housing Department help us apply for housing? This listener says we call for applications and information on house building status and are met with annoyance or reluctance to help us out, this listener claims. So that's a question with regards to housing.
What was that first part of that? Sorry.
Why won't Mohawk Council of Akwesasne Housing Department help us apply for housing? The caller says that we call for applications and information on house building status and are met with annoyance or reluctance to help them out.
Mm-hmm. Well, I mean, I would expect that, every employee of the Mohawk Council provide a level of service that's professional and courteous to our members. I mean, that's why we're here at the Mohawk Council, is to provide service to our people. If there is an issue with the service standards of how a community member has access to service, I would encourage them to reach out to executive services, and there is a service complaint process that they need to just jot down their experience, whether positive or negative, in fact, and it will be looked into why these sort of things are happening. But any community member wanting information and service from the Mohawk Council should be able to do that when necessary. And if they feel that their service level is not to their standard, please file a grievance or a complaint, and these will be investigated by the supervisors.
For families who want to adopt within the community, where do we go about for applying for adoption?
Mm-hmm. So the ACFS program can be their first resource to talk about being foster parents or to be parents to adopt children or a child. I would say reach out to the Akwesasne Child and Family Services. They can help navigate them from there. They may need to go to some legal services, but they would be their best resource.
All right. And the new council that came in over the summer, have you guys shared some portfolios yet? And can you share that with the community?
Yes, absolutely. So yes, we have signed portfolios. In fact, I think it was presented at the September general meeting. So I would encourage the community member to either reach out to the Mohawk Government Office to find out which member of council is on what committee. I will say that we can share it on our Facebook page following this as just a public service announcement, but also in the alternate, the recording of the September general meeting is available on the MCA Facebook page and is available on YouTube. If they want, they can listen in there. There is a presentation that was done on who is on what portfolio. So those are three venues that a community member can get to find out that information. I don't have it right now, but it's, you know, surely you can appreciate 12 members of council and number of portfolios. We could spend, you know, 20 minutes going through that in itself.
Okay. And with regards to the weather changing and our arena, what are we using our arena for? And will they ever return to it for the ice, for the skating, for hockey, things of that nature during the winter months? What's our arena being used for?
It's my understanding that the ice has been put in the arena and that, you know, it will be made available for rentals. I do know that one of the local organizations has determined that they will not be operating this year. I can't remember which one it is, but it is a ice user. The ice is available for rentals, as the policy is for the arena. Any users will be required to be vaccinated as well.
I think that that's all that I have for questions from the community. If I missed, I will pass those along to you, Grand Chief. We'll give you a few minutes right now to wrap up today's program now that we've gone an hour.
Absolutely. Well, thank you as always, Reen, for hosting today and allowing me to provide an update to the community. Thank you for the questions. I surely enjoy answering the questions of the community. I believe in transparency and being accountable to the community and accessible by the community. And I don't have ever an issue of answering these questions. And when we don't have the answers, you know, we will go find them and hopefully explain, you know, them to the community to the best of my ability. We do have a member. Our council is also well versed in a number of issues, and if they can't find an answer for you, if they don't have an answer for you, they will find an answer for you as always. So I did miss a month of update. My apologies for that. I will hopefully have an update in the beginning of December, just to mark, provide an update to the community, as well as you know, we will be sharing the information on the holiday initiative. But so I'll be back in, you know, in about a month's time from now, before the new year. But as always, it's a great pleasure. You know, we've talked a lot about vaccination policies, and again, these are measures that we have put in place to make sure that we're doing the best that we can to keep our community safe. I encourage all community members that are not vaccinated to consider getting vaccinated. Speak to our doctors. We have an amazing medical team here at the Mohawk Council who has been doing a lot of phenomenal work. They're working day in and day out from all levels, from the nursing homes to the home care to the administration to make sure that we're there providing supports to the community. There's a lot of people there with a lot of resources. If you have questions, comments, give them a call. They're available. But otherwise, Reen, thank you so very much as always. It's great to see you, and you know, I hope you have a great afternoon. And thank you, Akwesasne. We will get through this pandemic. It's just it is a one day at a time, and we must take this as we can. So Yamagoa.
Grand Chief, and we'll see you next time. Ona.